What is autism? Autism is a developmental disorder characterized by difficulties with social interaction and communication, and by restricted and repetitive behavior. Parents often notice signs during the first 3 years of their child's life. These signs often develop gradually, though some children with autism experience worsening in their communication and social skills after reaching developmental milestones at a normal pace. Autism is associated with a combination of genetic and environmental factors. Risk factors during pregnancy include certain infections, such as rubella, toxins including valproic acid, alcohol, cocaine, pesticides, lead, and air pollution, fetal growth restriction, and autoimmune diseases. Controversies surround other proposed environmental causes, for example, the vaccine hypothesis, which has been disproven. Autism affects information processing in the brain, and how nerve cells and their synapses connect and organize. How this occurs is not well understood. The Diagnostic and Statistical Manual of Mental Disorders (DSM-5) combines autism and less severe forms of the condition, including Asperger syndrome, and pervasive developmental disorder not otherwise specified (PDD-NOS) into the diagnosis of autism spectrum disorder (ASD). Early behavioral interventions or speech therapy can help children with autism gain self-care, social, and communication skills. Although there is no known cure, there have been cases of children who recovered. Some autistic adults are unable to live independently. An autistic culture has developed, with some individuals seeking a cure, and others believing autism should be accepted as a difference to be accommodated instead of cured. Globally, autism is estimated to affect 24.8 million people as of 2015. In the 2000s, the number of people affected was estimated at 1 to 2 per 1,000 people worldwide. In the developed countries, about 1.5% of children are diagnosed with ASD as of 2017, from 0.7% in 2000 in the United States. It occurs 4 to 5 times more often in males than females. The number of people diagnosed has increased dramatically since the 1960s, which may be partly due to changes in diagnostic practice. The question of whether actual rates have increased is unresolved. Autism is a highly variable, neurodevelopmental disorder whose symptoms first appear during infancy or childhood, and generally follows a steady course without remission. People with autism may be severely impaired in some respects but average, or even superior, in others. Overt symptoms gradually begin after the age of 6 months, become established by age 2 or 3 years and tend to continue through adulthood, although often in more muted form. It is distinguished by a characteristic triad of symptoms: impairments in social interaction, impairments in communication, and repetitive behavior. Other aspects, such as atypical eating, are also common but are not essential for diagnosis. Individual symptoms of autism occur in the general population and appear not to associate highly, without a sharp line separating pathologically severe from common traits. Social development. Social deficits distinguish autism and the related autism spectrum disorders (ASD) from other developmental disorders. People with autism have social impairments, and often lack the intuition about others that many people take for granted. Noted autistic Temple Grandin described her inability to understand the social communication of neurotypicals, or people with typical neural development, as leaving her feeling like an anthropologist on Mars. Unusual social development becomes apparent early in childhood. Autistic infants show less attention to social stimuli, smile, and look at others less often, and respond less to their own name. Autistic toddlers differ more strikingly from social norms. For example, they have less eye contact and turn-taking, and do not have the ability to use simple movements to express themselves, such as pointing at things. 3 to 5-year-old children with autism are less likely to exhibit social understanding, approach others spontaneously, imitate, and respond to emotions, communicate nonverbally, and take turns with others. However, they do form attachments to their primary caregivers. Most children with autism display moderately less attachment security than neurotypical children, although this difference disappears in children with higher mental development, or less pronounced autistic traits. Older children and adults with ASD perform worse on tests of face and emotion recognition, although this may be partly due to a lower ability to define a person's own emotions. Children with high-functioning autism have more intense and frequent loneliness compared to non-autistic peers, despite the common belief that children with autism prefer to be alone. Making and maintaining friendships often proves to be difficult for those with autism. For them, the quality of friendships, not the number of friends, predicts how lonely they feel. Functional friendships, such as those resulting in invitations to parties, may affect the quality of life more deeply. There are many anecdotal reports, but few systematic studies of aggression and violence in individuals with ASD. The limited data suggest that, in children with intellectual disability, autism is associated with aggression, destruction of property, and meltdowns. Communication. About a third to a half of individuals with autism do not develop enough natural speech to meet their daily communication needs. Differences in communication may be present from the first year of life, and may include delayed onset of babbling, unusual gestures, diminished responsiveness, and vocal patterns that are not synchronized with the caregiver. In the second and third years, children with autism have less frequent and less diverse babbling, consonants, words, and word combinations. Their gestures are less often integrated with words. Children with autism are less likely to make requests or share experiences, and are more likely to simply repeat others' words, echolalia, or reverse pronouns. Joint attention seems to be necessary for functional speech, and deficits in joint attention seem to distinguish infants with ASD. For example, they may look at a pointing hand instead of the pointed at object, and they consistently fail to point at objects in order to comment on or share an experience. Children with autism may have difficulty with imaginative play, and with developing symbols into language. In a pair of studies, high-functioning children with autism aged 8 to 15 performed equally well as adults better than individually matched controls at basic language tasks involving vocabulary and spelling. Both autistic groups performed worse than controls at complex language tasks such as figurative language, comprehension, and inference. As people are often sized up initially from their basic language skills, these studies suggest that people speaking to autistic individuals are more likely to overestimate what their audience comprehends. Repetitive behavior. Sleeping boy beside a dozen or so toys arranged in a line. A young boy with autism who has arranged his toys in a row. Autistic individuals can display many forms of repetitive or restricted behavior, which the Repetitive Behavior Scale Revised (RBSR) categorizes as follows. Stereotype behaviors, repetitive movements, such as hand flapping, head rolling, or body rocking. Compulsive behaviors, time-consuming behaviors intended to reduce anxiety that an individual feels compelled to perform repeatedly, or according to rigid rules, such as placing objects in a specific order, checking things, or hand washing. Sameness, resistance to change, for example, insisting that the furniture not be moved, or refusing to be interrupted. Ritualistic behavior, unvarying pattern of daily activities, such as an unchanging menu, or a dressing ritual. This is closely associated with sameness, and an independent validation has suggested combining the two factors. Restricted interests, interests or fixations that are abnormal in theme or intensity of focus, such as preoccupation with a single television program, toy, or game. Self-injury, behaviors such as eye-poking, skin-picking, hand-biting, and head-banging. No single repetitive or self-injurious behavior seems to be specific to autism, but autism appears to have an elevated pattern of occurrence and severity of these behaviors. Other symptoms. Autistic individuals may have symptoms that are independent of the diagnosis, but that can affect the individual or the family. An estimated 0.5% to 10% of individuals with ASD show unusual abilities, ranging from splinter skills, such as the memorization of trivia, to the extraordinarily rare talents of prodigious autistic savants. Many individuals with ASD show superior skills in perception and attention, relative to the general population. Sensory abnormalities are found in over 90% of those with autism, and are considered core features by some, although there is no good evidence that sensory symptoms differentiate autism from other developmental disorders. Differences are greater for underresponsivity, for example, walking into things, than for overresponsivity, such as distress from loud noises, or for sensation seeking, such as rhythmic movements. An estimated 60 to 80% of autistic people have motor signs that include poor muscle tone, poor motor planning, and toe walking. Deficits in motor coordination are pervasive across ASD and are greater in autism proper. Unusual eating behavior occurs in about 3/4 of children with ASD, to the extent that it was formerly a diagnostic indicator. Selectivity is the most common problem, although eating rituals and food refusal also occur. There is tentative evidence that gender dysphoria occurs more frequently in people with autism. Gastrointestinal problems are one of the most commonly associated medical disorders in people with autism. These are linked to greater social impairment, irritability behavior, and sleep problems, language impairments, and mood changes. Parents of children with ASD have higher levels of stress. Siblings of children with ASD report greater admiration of and less conflict with the affected sibling than siblings of unaffected children, and were similar to siblings of children with Down syndrome in these aspects of the sibling relationship. However, they reported lower levels of closeness and intimacy than siblings of children with Down syndrome. Siblings of individuals with ASD have greater risk of negative well-being, and poorer sibling relationships as adults. Causes of autism. It has long been presumed that there is a common cause at the genetic, cognitive, and neural levels for autism's characteristic triad of symptoms. However, there is increasing suspicion that autism is instead a complex disorder, whose core aspects have distinct causes that often co-occur. Autism has a strong genetic basis, although the genetics of autism are complex, and it is unclear whether ASD is explained more by rare mutations with major effects, or by rare multigene interactions of common genetic variants. Complexity arises due to interactions among multiple genes, the environment, and epigenetic factors, which do not change DNA sequencing, but are heritable and influence gene expression. Many genes have been associated with autism through sequencing the genomes of affected individuals and their parents. Studies of twins suggest that heritability is 0.7 for autism, and as high as 0.9 for ASD, and siblings of those with autism are about 25 times more likely to be autistic than the general population. However, most of the mutations that increase autism risk have not been identified. Typically, autism cannot be traced to a Mendelian single-gene mutation, or to a single chromosome abnormality, and none of the genetic syndromes associated with ASDs have been shown to selectively cause ASD. Numerous candidate genes have been located, with only small effects attributable to any particular gene. Most loci individually explain less than 1% of cases of autism. The large number of autistic individuals with unaffected family members may result from spontaneous structural variation, such as deletions, duplications, or inversions in genetic material during meiosis. Hence, a substantial fraction of autism cases may be traceable to genetic causes that are highly heritable but not inherited. That is, the mutation that causes the autism is not present in the parental genome. Autism may be underdiagnosed in women and girls due to an assumption that it is primarily a male condition, but genetic phenomena such as imprinting and X-linkage have the ability to raise the frequency and severity of conditions in males. Theories have been put forward for a genetic reason why males are diagnosed more often, such as the imprinted brain theory and the extreme male brain theory. Maternal nutrition and inflammation during preconception and pregnancy influences fetal neurodevelopment. Intrauterine growth restriction is associated with ASD, in both term and preterm infants. Maternal inflammatory and autoimmune diseases may damage fetal tissues, aggravating a genetic problem, or damaging the nervous system. Exposure to air pollution during pregnancy, especially heavy metals and particulates, may increase the risk of autism. Environmental factors that have been claimed without evidence to contribute to or exacerbate autism include certain foods, infectious diseases, solvents, PCBs, phthalates, and phenols used in plastic products, pesticides, brominated flame retardants, alcohol, smoking, illicit drugs, vaccines, and prenatal stress. Some, such as the MMR vaccine, have been completely disproven. Parents may first become aware of autistic symptoms in their child around the time of a routine vaccination. This has led to unsupported theories blaming vaccine overload, a vaccine preservative, or the MMR vaccine for causing autism. The latter theory was supported by a litigation-funded study that has since been shown to have been an elaborate fraud. Although these theories lack convincing scientific evidence, and are biologically implausible, parental concern about a potential vaccine link with autism has led to lower rates of childhood immunizations, outbreaks of previously controlled childhood diseases in some countries, and the preventable deaths of several children. Autism symptoms. Autism symptoms result from maturation-related changes in various systems of the brain. How autism occurs is not well understood. Its mechanism can be divided into two areas: the pathophysiology of brain structures and processes associated with autism, and the neuropsychological linkages between brain structures and behaviors. The behaviors appear to have multiple pathophysiologies. There is evidence that gut-brain axis abnormalities may be involved. A 2015 review proposed that immune dysregulation, gastrointestinal inflammation, malfunction of the autonomic nervous system, gut flora alterations, and food metabolites may cause brain neuroinflammation and dysfunction. A 2016 review concludes that enteric nervous system abnormalities might play a role in neurological disorders such as autism. Neural connections and the immune system are a pathway that may allow diseases originated in the intestine to spread to the brain. Several lines of evidence point to synaptic dysfunction as a cause of autism. Some rare mutations may lead to autism by disrupting some synaptic pathways, such as those involved with cell adhesion. Gene replacement studies in mice suggest that autistic symptoms are closely related to later developmental steps that depend on activity in synapses and on activity-dependent changes. All known teratogens, agents that cause birth defects related to the risk of autism, appear to act during the first 8 weeks from conception, and though this does not exclude the possibility that autism can be initiated or affected later, there is strong evidence that autism arises very early in development. Thanks for watching our video. Make sure you subscribe to receive more video related to autism, autism treatment, and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.